Spain is reeling under a severe healthcare crisis and people's indignation seems to be multiplying with every passing month. The situation in Madrid has been reported to be extremely critical. Yesterday, hundreds of thousands of Spaniards flooded the streets of Madrid for the largest protest yet against the regional government's management of the capital city's healthcare services. Over 250,000 people rallied in the city center yesterday according to the central Spanish government, but the organizers claimed that the crowd was actually around 1 million. Many protesters carried homemade signs with messages in Spanish that read, "The right to health is a human right, defend the health service." In this video, we decode this healthcare protest happening in Spain, especially in Madrid, besides explaining how Madrid has come to the brink of a healthcare disaster. But before that, don't forget to like, share and subscribe to Oneindia. Spain has a hybrid healthcare system. Spain's national health system is publicly funded and structured into two healthcare levels, primary and specialist. The public sector is larger than the private one and is considered a basic pillar of the state and is run by Spain's regions. Regional governments in Spain are responsible for a large part of the health budget as part of the country's devolved political system. Under a decentralized functioning, the 17 Spanish autonomous communities can establish their own package of healthcare services. But people, especially in Madrid, are not happy with this arrangement. They have been protesting against what they say is the dismantling of the public healthcare system by the Madrid region's conservative-led government. These groups have taken to the streets on a regular basis in recent months and their movement is gathering strength. Yesterday's demonstrations have come just months after public health workers and their supporters staged a protest in Madrid last November. It was dubbed the White Tidal Wave on account of the white medical coats worn by the protesters. But what exactly are the problems and the allegations? There are actually quite a few. First, the general public and healthcare workers claim that the Popular Party government in Madrid has been reducing the funding of the public healthcare system, which has led to a severe paucity of resources and staff in public hospitals. They also claim the regional government led by Isabel Ayuso of preferential treatment of private sector. Healthcare workers claim that Isabel Ayuso's administration spends the least amount per capita on primary healthcare of any Spanish region, even though Madrid has the highest per capita income. They say that for every €2 spent on healthcare in Madrid, one ends up in the private sector. Her policies during the COVID-19 pandemic were severely criticized, with Madrid registering one of the highest excess mortality rates in Europe. Primary care services have been strained since the pandemic, and medical workers last November protested against the regional government's plan to allow more private participation in healthcare partnerships. In Madrid, the richest and most densely populated region with nearly 7 million people, annual spending per resident is just €1,491, the second lowest of Spain's 17 autonomous regions, according to a 2020 Health Ministry report. Besides, her decision to reopen 80 walk-in centers for non-hospital emergencies that were closed at the start of the pandemic, but with staffing levels at half of what they were, had also previously sparked criticism. This had led to local healthcare centers being grossly understaffed, their doctors being overwhelmed with scores of patients and never-ending waiting lists. The current protest comes amid a wave of strikes over public healthcare shortages across Spain, with strike action planned or threatened in at least 8 of its 17 regions. For years, the doctors across Spain and specifically in Madrid have been claiming to be overworked and understaffed, but their grievances had been falling on deaf ears. Due to this, in the last decade alone, almost 20,000 Spanish doctors had emigrated abroad. This has compounded the problems at local levels. And on her part, Ayuso has denied all these allegations. She claims that protests are driven by the political interests of left-wing rivals in the run-up to municipal and regional elections in May across most of Spain. She has simply brushed this off as political opportunism. So, in short, these latest strikes of healthcare workers are in protest about working conditions, including long hours, pay, and fundamentally a lack of doctors in the system, putting huge pressure on their workloads. This was all about the protest by the healthcare workers in Madrid. More such protests have been planned in other regions as well. We hope you would like this new video. Thank you for watching.